Okay. Hi, everyone. Thank you for joining us for this talk today. I'm very excited to demo our prototype, Climate Health Pulse. My name is Tali, and I am from DataKind. I have a few other colleagues here as well from DataKind. We are a global nonprofit organization, and we have our reason for existence, if you like, is mainly to close the technology gap that a lot of social impact organizations face when working with data science, when working with AI. And essentially, the way DataKind works is we collaborate with amazing experts like yourselves, and we work with highly impactful organizations in particular sectors to then design and develop products that are sector-facing. So it's not really focused on just solving bespoke problems for a partner or a social sector organization, but really trying to understand the pain points that impact the sector as a whole, and then work with a few key actors to actually design and develop those products that are then available as open source products to the sector as a whole. It is our mutual commitment to building a more just world through responsible and ethical use of data science and AI. So the solution that I'm going to demo today has been developed in collaboration with such partners. So I want to just name them. They're not here, but I want to highlight Spectrum Africa. This is a Kenyan-based organization that they work to bring together multiple sectors to work together on uncovering sort of the hidden connections between climate and health, and climate health, and also generally well-being of people, which, as we know, has more implications than just health. I also want to mention Jacaranda Health. They partner with governments, public hospitals, and with pregnant and new moms directly to design and develop products to support their mums on their journey, on their pregnancy journey and through motherhood, the early stages of motherhood. Their flagship platform is Prompts, and Prompts supports nearly 3 million subscribers at this point, new and expecting mothers, through a two-way SMS messaging platform. And they basically send stage-specific messages to those mums, and they also respond to queries from those moms. And we wouldn't be able to show you this demo today without the cooperation, without the support of Kajiado County. This is a county in southern Kenya. The Ministry of Health specifically from this county has partnered with us to be able to share their data and show you what's actually possible to do now. Just to let you know a little bit about Kajiado County, it's beautiful. It has valleys and plains, and it's sort of an arid, semi-arid kind of climate, home to 1.1 million people, mostly, for the majority, a pastoralist community. You might have heard of the Maasai Mara. The Maasai, they predominantly live and work in this area. And they face their share of climate challenges. They really struggle with heat, stress, as well as water scarcity. All right, so climate change in Kajiado County and around the world is really it's a current and escalating health crisis. We have recurrent droughts, we have erratic rainfall, heat waves. They directly impact health. And in some cases, climate change is sort of impacting it's increasing the risk of certain climate-sensitive diseases. In other cases, it's changing the way those diseases manifest. It's making it, the seasonality of those diseases, it's just making it harder to anticipate when certain diseases will strike and to what extent. This is known. We know it. Health systems overall around the world, they know it. And at the most local levels, they're facing, health systems are really facing the strain of these health crises. So it's no longer a question about, how we use climate data, how do we better use publicly, just how do we use climate data for health, but what can you do with that? What kind of action could it support? I just want to mention that the way we build our products at DataKind, it is based in understanding the needs of the sector. I mentioned that earlier. So last year, DataKind spent about 10 months in dialogue with a variety of different stakeholders, including data providers, including developers, including folks who are actually in the decision-making space when it comes to health systems, researchers, policymakers, and so on. And also actually frontline health organizations like Jacaranda Health, who partner with governments to assist in strengthening those health systems. So we spoke to them. They're from across Africa and Asia and Europe mostly, and some in North America. And what we found was that health stakeholders, especially across the vast global south, definitely recognize the need for and are actively seeking climate-informed health data to support their decision-making processes. But despite that demand, there is a critical disconnect. I think this was actually mentioned in a few presentations, but the data is actually quite fragmented, and the formats are such that it makes it quite challenging for folks in the health sector to use data from, let's say, the climate sector. Also, the climate and health, yes, have generally and traditionally worked sort of in silos. So bringing them together is one part of the problem. But then even when that data is available, that localized, near real-time climate information is rarely actually integrated into existing workflows. And that's where it could actually have the most impact. So for what we found was that this really represented a significant missed opportunity to strengthen health system resilience through better integration of the data. You can actually, if you're interested, you can read more about that report and the challenges that limit climate and health data integration in our landscape report, as well as we've also noted some promising innovations from around the world in our report, so you can use that QR code to get there. And what you'll note in the report is while the ecosystem is fragmented and siloed, government agencies are absolutely central. They are absolutely central to enabling that data access and the data utilization. Questions around data availability, interoperability, and capacity, they are persistent, yes, but actually solvable. And while resources are limited, we can still focus on feasible, cost-effective, open source approaches to strengthening existing capacity. And this is coming at it from a sort of equity lens as well. So we wanted to find out then, okay, what if we were able to actually integrate climate and health data? Rather than developing some kind of a narrow tool, we are working on an integrated platform that can potentially unlock that more ecosystems level thinking. So enabling more sectors to come together, more sectors to collaborate, bring their data onto a shared platform, and enable iterative learning. So that is our first step towards that is Climate Health Pulse. In its current form, it brings together climate data and health indicators at a granular county level and at actually levels below that. So in Kenya, you have the national, you have county, sub-county, and ward level. So this is looking at county and below, so as localized as we can possibly get when it comes to administrative boundaries. It exists in this iteration again to make climate and health data useful, usable, actionable for local governments. And really understanding risk is one part of it, yes, but also opening up those opportunities to act on it. What we really wanted to show is that Pulse is not just about like a data source or bringing together some, couple of layers, but it's really about layering on multiple sources of information from multiple sectors to create that actionable climate-related intelligence on which you can work. Pulse is a solution that is designed to evolve with new partnerships. This is by design. We're working on it with that. It is, we need new partnerships, we need new data, we need new indicators, new geographies, and I think we are here as DataKind in part to learn about other tools as well that we should be aware of that we should be using as well. It's being developed as a free and open source platform. At DataKind, we do see open development as the most effective way to maximize transparency, reuse, and adaptability. So really ensuring that the tools we build can be sustained, improved, and deployed long after sort of individual partnerships fade away and that ends. We're also developing Pulse to digital public good standards, and there is, I think, I don't know if anyone here is from the DPGA. The Digital Public Goods Alliance, they have a stand outside as well. It's a really important, particularly when we're working with government actors, to enable them to use open source software. It is an important sort of accreditation. There is a trust involved in using digital public goods that are open source tools and platforms. So we use those standards, we develop to those standards with the goal that even if it isn't certified right now, it's on the path to that certification. Okay, with that, I'm going to go into the demo. Let's see, I'm going to do this a bit backwards. Right. So we can just get started. All right, this is the main page. It just contains, the information that I've already shared with you just now about the project. As we scroll down, right here, you get to our featured prototype, and basically this does show, because we're talking about Kajiado County, just wanted to highlight again the different data sources. So I'm trying to manage two screens here. Okay, we have health data from the Kenyan Ministry of Health. This is private data, so it's not, right now, if you try to go on there, you can't actually access this. This tool. We are working on a open data set that's going to be available, and then we'll be able to open source our project here. We also have not just sort of health, from the health informatics system, we have the data, but we also have facility lists. So really getting down granular to the actual health facility, whether it's a clinic or a hospital in Kajiado County. There are 116 active government facilities in that county, so we have that level of data as well. All anonymized, we do not look at the actual patient records right now. We have climate data sourced from Copernicus, so for the last group that was here talking about that. It's the ERA 5 data set, which is a really crucial data set for climate research, offering consistent data on temperature, precipitation, wind, and more at a fairly good resolution of 9 by 9 square kilometers. And we also have actually forecast data coming in from the Kenyan Meteorological Department directly. So we're actually working now closely to build that local relationship with KMET and make sure that they are the ones who are also providing the climate data. And then finally, we also have the Jacaranda Health prompts data that I mentioned earlier. Mums from across the country are asking thousands of questions about their pregnancy and about their babies. It's a really valuable data set. They've shared sort of subject matter classifications of those text messages, aggregated at ward levels and different levels. But this data gets us a community report. It's really the first time that we're working on a tool that not only has like government data and other kind of globally available like open data sets, but really trying to bring in community data as well. So how people actually experience climate. So if we go into the actual tool. All right, so this is the overview page. Here we have essentially 4 layers of information that you can see. It's not showing the rest. Anyway, it looks a bit different on my computer than there. So this essentially shows Kajiado County's map. You see the different ward levels. The color to represent sort of the disease incidence rates and so on is just a fairly straightforward and easy way to visualize patterns, identify any hotspots, that kind of thing. It's super helpful. On the map, you can kind of see, I think, the health facilities. We have like the actual So you can actually see we've got the health facility locations mapped on as well. Right now, this just has very basic information about that health facility, but for the actual government user, the end user, they would have detailed information about that health facility, including specific, for specific indicators, what are the rates and so on. Okay, and then next down below here is a simple line chart, again, just showing that health outcome trend for any given indicator over time. This is also extracted from the Kenyan Ministry of Health information system. Here we have climate information, so total precipitation, average daily max temperature. This is that Copernicus data set. And then below that, a simple line chart, again, showing those community reports, the prompts data. And you can actually like search those as well and kind of look at the trends there. Some additional features involve, you can actually select an indicator. So again, you can actually pick your indicator. I'm going to start looking at malaria in a second, which we know has quite a bit of relationship with climate. So there, you can look at it for different time periods. Really see what's happening. This is now over an almost 3-year period. And depending on what you find, it's got a few other key features just to help. You can download these images in different formats. And yeah, so you can look at it. And you can actually drill down further. You can actually go from that county level to different sub-county level or ward level even, and look at the data more locally. So if we look at malaria, you set that date range, you can actually have a sense of what's happening over time when you play it out. And you'll just see that there's the north part of the country, this is just based on, this is a normalized data set from what we received. You can see the north part of the county really, in general, has particularly high confirmed cases. It's a hotspot for malaria. You can get closer into that and drill down and see what's going on, particularly in this ward here. You can zoom in and have a look. And the end user would be able to actually see what's going on at the specific health facilities. The more important thing is, though, on the right, you actually get to see what's going on and what's been going on with climate, what's been going on with temperature, what's been going on with rainfall over the same period of time. And you'll notice that all the other layers adjust, as you sort of drill down, all the other layers also adjust to give you the data about that specific ward and area. Trend line really helps to see and understand, like, okay, what's going on. This looks like a particularly high peak. You kind of see where the trend line starts to show an increase, and you can actually start to adjust. Even just trying to look at what's happening with temperature and rainfall when there is a known, where the trend line for malaria cases are increasing. This is something that the local government actors just weren't able to do. It was just not something that they could look at on just one simple dashboard. Further down, you can actually, I have some use cases where we worked with the Kajiado County health officials to look at specifically when there was a drought, what happened to malnutrition cases during that drought, what happened to rainfall, and start to actually study and see what are the types of issues that mums were raising during those specific events, climate events. I'll just show you a little bit, speaking of that, the prompts data here. Oh, nope, went to the wrong one. That one. Yeah. So this enables users to also explore the issues cropping up on prompts at the time. It's an opportunity as an institution to actually learn more about community issues during climate events. There's an amazing study that Jacaranda Health have done that actually that's published that shows that prompts data tells us about how those millions of mums are experiencing extreme heat, and we wanted to include that here as part of the perspective to inform the public health actions. So in this first set of visuals, basically we can investigate the relative distribution of those intents in sort of different temperature buckets and bins. And we can see the changes in frequency of those specific intents. In general, I would say the questions about what we found, questions about, in studying this further, pregnancy, newborns, questions about intercourse, questions about pain, swelling, urinary tract infections, those kind of questions actually we see there is an increase at higher temperatures in those buckets, and the effect is modest, but it is statistically significant. A couple more examples. Again, when you search for different intents that we know are related to heat events, or we suspect, there is a relationship here. For example, mums talking about swelling or edema. When temperature climbs above 30 degrees, we see nearly 70% rise in those types of concerns. We see a 23% rise when we looked at questions about labor. And in other kinds of, for different health indicators, for instance, with children and babies, we also saw similar kind of relationships in the frequency of intents around things like diarrheal diseases, fever spikes, inability to feed, and so on. What we found, basically, what we demonstrate to, and this is again, think about the institutional user in mind, what we're trying to show is heat isn't just uncomfortable for pregnant women, it's changing what they need from the health system. So this is a critical input that wasn't actually available to those health system managers until now. And I think this is also consistent. Essentially, when you have extreme heat, when you have a climate event, engagement with that platform increases. It's also part of it's the contributing factor as well to the kind of things we're seeing. But beyond just looking at sort of like existing historical data and what's happened, the county health officers want to use data like this to think about the future and think about, okay, what can be done to adapt, to build resilience, what strategies are open to them. And this is where we were actually inspired by the work of Carrie et al. I do have the links available as well. We use generalized additive models to understand the relationship between temperature and precipitation and maternal and newborn health indicators. This was actually developed, this methodology was developed in the DRC. It's open source, it's available, and we used it in the Kenyan context to forecast the relationship between temperature and precipitation from Copernicus and the health indicators mentioned here. So yeah, you can see there's a predictive forecast space that's really right now has a lot of uncertainty associated with it. It's currently not necessarily actually useful in its current format, but this is another area where I think we're very keen and open to have partnerships to bring more relevant data, more relevant models, validate those models, and actually make this, put this in front of decision makers to think about really what can be done. Can we think about more disaggregated ways of supporting health systems? So, yeah, like I said, we are looking. This is all about partnerships. So and cooperation, community. We develop Pulse, and we're starting to develop those partnerships in community around climate health data integration, modeling, validation. Please consider joining our community. You can select, we have some options, select ways in which you'd like to contribute, or suggest ways in which we haven't even thought of. I mean, we definitely need a lot of different expertise here to actually build this into a project that not only serves Kajiado County and all the counties of Kenya, but actually make this into a project that can be then adapted to multiple different locations. Again, really localizing the way in which we look at climate data and other sector-based data like health. So with that, I'll say you can check out the website, but sorry, you can't see the tool just yet. Yeah, and thank you.
Any questions?
Do you provide public Do you provide public datasets for download?
We're working on it, but actually, for demonstrative purposes, yes, that's what we're working on, public, like open data sets just to kind of see what the tool can do. But I think it would be quite interesting for us to actually provide public data sets that can be used in specific locations or that can be tailored to a certain location. So yeah, I would be open for that. Thanks.
Hey.
Hi.
Thank you for the valuable presentation. I'm a bit curious, depending on you, what is the decision that deciders should take in that particular case? What are the conclusions we can withdraw from this data?
What brought us to build this in the first place? Is that your question? Sorry.
Yes, the
The
problem.
motivation? Mm-hmm.
Yes, and this with the data we have now, what can we do with it concretely?
Mm-hmm. That's a great question. Thanks. So part of why this came about in the first place is because of who we are as an organization. So we have been working to support frontline health systems with open source tooling for the last 6 years, I would say. And one of the major issues actually that came up early on was around we have a lot of data, we have digital data, but we don't trust it, we don't want to use it. So data quality was usually what we'd come up against before we heard any other issues. So we initially started working on tooling, which is actually a digital public good. It's open source. It's called the Data Observation Toolkit, or DOT. And that is available right now and is in use by these health systems. But as we got more interactive with the health managers, with the governments, more explicit use cases started to emerge. And this issue around, climate is always there. Some governments are further along in terms of having a climate agenda. Kenya was particularly receptive to, they have a strong policy, but also want to show tooling that kind of interacts and informs that policy as well. So we found a really favorable environment for working with government partners on this. Plus it also provided us, we've been working for several years on actually open source, it's a methodology that is now open source and available, but how to actually pair climate and health data. So we've been working with the UK's Office of National Statistics, along with Ghana, Rwanda, and a couple of other places on that methodology. So this was an opportunity now to start to bring all of those pieces together on a platform that could work on this. And then I think the second part of your question was around, sorry, you're going to have to remind me the second part. Just say it out loud.
What's concretely?
What they can do with it. Thank you. So our partners in Kajiado County and from other counties who have so far seen this, the kind of actions they're keen to take is, for instance, being able to understand a little bit more of the specific variants of the diseases and the relationship to the climate to think about, okay, where can you send certain drugs in advance? Where can you impact supply chain, for instance? What can you do to support the community health workers when you know there is a spike coming up of certain types of diseases? That's one thing. You can also look at the community reports to understand the kind of questions that the community itself has. And so start to engage your community health promotion, campaign, messaging, and so on, based specifically on the data and information you're getting from people themselves. So there are quite a few operational things that can be done. It's a matter of now seeing if they have the confidence in the data to be able to take that forward.
Hi, yes.
Hi.
On that slide, on the way to contribute, you mentioned red team expertise.
Yeah.
What does that look like in your use cases?
I'm going to ask our VP of Technology, Larry, to speak to that.
So as you can imagine with a tool like this, oh, sorry. As you can imagine with a prototype like this, before we publicly start putting it out for use and having people contribute, we are wanting to think of what are we not thinking about before we do that. And so when we say red team expertise, we're thinking about some of the skills that are already listed here, like data security experts in Kenyan health data and the rules protecting that, but also saying, here are the things that you haven't thought about yet, so that our implementation plan to go ahead and make this not a prototype, but the real tool that could be used, not just at the county level, but in all of Kenya first and potentially in the region. We don't have necessarily all the expertise because of our individual focuses. So what we want is for people who've done implementations like this to say, here are the things that you aren't thinking about, and then help us test it to make sure we've implemented all those things we haven't thought about and the ones that we've thought about. Does that? Yep. Great.
Since we have VP of Technology in the room, I have a question on the technical side. My understanding is that this tool is open source. Could you share a little about the tech stack used to create this tool?
Sure. Yeah, I'll come. So currently, as you can see, all the way to the left, we are using some of the public data sources, but we are still using some of the private data sources and working on how to make those available. But the actual tech stack is, as you can see, we do a bunch of processing, and those are done with both Python and R scripts, shell scripts, running the modeling. And then that is put into the data layer, which is a PostgreSQL, as well as a GIS extension, since this is a GIS room. And then we're using on that back-end layer Nest.js, the Nest.js API. The front end is really pretty simple. It's basically React primarily. And then for the maps here, we're using Leaflet. And then all of that we're running right now on a GCP instance, which is all pretty much a straightforward cloud run deployment connecting to a cloud SQL. And then for the monitoring, we're using a bunch of both native tools and some third-party tools to do that monitoring, things like Datadog, which are commercial, but do have open source APIs that you can go ahead and install. And then, of course, the native stuff in GCP. So the primary parts of the stack are pretty much Python and React. Does that answer? And as we go forward, we'll be looking for more opportunities, as Tali said, as we do progress more on the modeling, is how can we integrate more modeling options in a better way. So we'll start to look at some of the options that come with some of the different modeling packages that can do real-time selection of modeling.
I think we've got time for one more quick question.
Thank you for the nice talk. I just have 3 quick points. One is there was recently in the news, the US bought all the Kenyan health data from the government. Do you have any comment on this? How does it affect what you're doing? And 2 is that I'm a member of a project called healthsites.io, and maybe we can talk afterwards if you would like to collaborate.
Health sites?
Health sites.
Oh, awesome.
Yeah.
Yes.
And 3, I'm a member of a project working on something called Tomorrow Now, where they're doing climate forecasting. And maybe it's also something we can chat about afterwards.
That'd be amazing. I would appreciate
so
the
just the one question was about the US buying all the health data.
Yeah, I don't think nothing specific to comment right now. I think we are also trying to understand the implications.
Any more questions? But I think we've still got time for one quick question, if anyone. Oh, okay, good.
Yeah. Thank you very much.